ఎందుకన్నా ఇదేందన్నా మళ్ళా కొంచెం కృష్ణ ఇక్కడ ఉంది రెడీ ఉందా సెటప్ అదా ఇక్కడ వచ్చిన తర్వాత మళ్ళా చూస్తా Thank you. Good morning, everybody. So today we are going to, I'm going to teach you something about this thoracic wall. Excuse me. About this thoracic wall and also a few important points which are related to this one, which are even important for the examination purpose. So let us start. Thorax, the region of the trunk between the neck and also the abdomen. To give a just brief introduction about this thorax, and this thoracic wall is composed of few important structures like the skin, the most superficial one, followed by the superficial fascia, then the deep fascia, then the muscles, the thoracic cage or the wall, and finally the thoracic cavity. So the thoracic cage, it contains few bones, that is the sternum, the most important one, which is in the anterior aspect of the thorax, which is composed of the manubrium, body and the xiphoid process. And also it contains, this thoracic cage contains 12 pairs of ribs. 1 to 7 are nothing but the vertebrosternal ribs. Why? Because they are also called the true ribs, because they start from the vertebrae and then gets articulated with the sternum. And 8th, 9th, 10th ribs are called as vertebrochondral ribs. Why they are called as the vertebrochondral ribs? Because they start from the vertebrae and finally they get articulated with the cartilage of the 7th rib, that is the 7th costal cartilage. And 11 and 12 ribs are called as the vertebral ribs or the floating ribs. Why they are called as the floating or the vertebral ribs? Because they start from the vertebrae but they end in between only, without even getting attached or articulation to any other bone. So hence they are called as the floating ribs. And also there are 12 thoracic vertebrae. So all these structures together, these bony structures together will form this thoracic cage. So extent of the thorax, you can see two imaginary lines which are drawn here. The first one, which is passing through the jugular notch, okay, that is the top of the sternum, and it is just crossing the T1, okay. So this is nothing but called as the one imaginary line which will form the inlet of the thorax. This is the inlet of the thorax, and from here again another imaginary line which passes through the in between, exactly in between the manubrium and body, okay, that is called as the sternal angle. So another imaginary line which passes through the sternal angle, and now you can see passing through the lower border of T4, lower border of the T4, that is 4th thoracic vertebrae. This is another imaginary line. So if with these two imaginary lines, now you can see this whole thorax or the space within this cavity is divided into, you know, like two divisions. One is called as the superior mediastinum, this part, okay, between the two imaginary lines, and the whole part which is below this second imaginary line which is passing through the sternal angle and the lower border of 4th thoracic vertebrae, it is called as the inferior mediastinum. So there are two mediastinum, that is superior mediastinum and the inferior mediastinum. So within this inferior mediastinum, again what happens is like there are three more subdivisions, and this is nothing but the body of the sternum, okay, and see the space which is there in between the body of the sternum and the, you know, like the pericardial region. So this space is called as the anterior mediastinum, and the one which is just in the central region, it is called as the middle mediastinum. And now the posterior part which is present between the pericardial region and also this vertebrae, thoracic vertebrae, is called as the posterior mediastinum. So in this way the thoracic cage or the cavity is divided into two subdivisions, two main divisions called as the superior mediastinum and the inferior mediastinum. And moreover, this inferior mediastinum is subdivided into anterior mediastinum, middle mediastinum and the posterior mediastinum. Now coming to the boundaries of the thoracic inlet. The boundaries are, that is the manubrium anteriorly, The first rib and the costal cartilage laterally, and also the thoracic vertebrae posteriorly. I will be again explaining you in detail about this. So you can see the thoracic inlet very clearly here. This is thoracic inlet, that is, this is superior thoracic aperture or the thoracic inlet. You can see now this is the superior border of the manubrium. Whatever line you are seeing, which is highlighted in red color. Okay, posteriorly you can see first thoracic vertebrae, and this is the first rib with the costal cartilage. And at the same time, you can see this is the another line which is highlighted in red color. But however, please see the line which is like you can see something which is highlighted in dashed lines, right? These dashed lines and in between this space, this thing is nothing but this is called as the costal margin. Okay, this region is called as the costal margin. And you can see the 12th thoracic vertebrae, and this is the outlet of the thorax. Now the role of thoracic cage in protecting the abdominal organs are nothing but this thoracic cage is helpful in protecting liver, okay, pancreas, and also the stomach. Now joints of the thoracic cage. So the joints between the vertebrae and ribs. So the body of vertebrae, that is vertebrae and head and rib, that is the costovertebral joint. It is a synovial type, and the transverse process and the tubercle of the rib, that is also called as it is a synovial joint, but it is called as the costotransverse joint. So there are two joints between the thoracic, like between the vertebrae and the ribs. So the one type of joint is nothing but the body of the vertebrae with the head of the rib. The second one is the transverse process of the vertebrae or at the tubercle with the rib, that is tubercle of the rib. So one is called as the costovertebral joint, which is present between the body of the vertebrae and the head of the rib, and the second one is called as the costotransverse joint, which is present between the transverse process of the thoracic vertebrae and the tubercle of the rib. Both these joints are synovial type joints, and why these joints are present is like these joints are especially helpful in the movements of the thoracic cage, especially like in elevation and depression of the ribs. Coming to the thoracic wall muscles, that is extrinsic muscles. You can see there are various muscles which also acts as accessory muscles which are helpful in respiration. The most important one are pectoralis major and minor, okay, and also you can see the serratus anterior, and especially you can see the cutaneous nerve supply is also seen in this picture, right? This is the intercostobrachial nerve which comes from T2 level, okay, and also you can see external oblique and nerve supply. This is the external oblique muscle with the nerve supply, okay, and now you can see these are all nothing but the anterior and posterior branches of the lateral cutaneous nerve, okay, which are derived from the intercostal nerves. Now the pectoral region. So the pectoralis major, it covers the chest wall, also makes up the anterior wall of the axilla, that is the palpate your anterior axillary fold and contract the pectoralis major, right? The clavicular and sternocostal origins, its tendon inserts into the humerus and it is innervated by both the medial and the lateral pectoral nerves. So this is one muscle from the pectoral region. The second muscle is the pectoralis minor. So it lies beneath the pectoralis major. It takes its origin from 3, 4, 5 ribs and it makes its insertion on the coracoid process of the scapula, and this is innervated by the medial pectoral nerve. Please remember, both the pectoralis major and minor are the accessory muscles of respiration. Now coming to the other extrinsic muscles, you can see this is the cut end of the clavicular head of the pectoralis major, right? And you can see the subclavius muscle here, and you can see the cut ends of, that is, proximal and distal attachments of the sternocostal head of the pectoralis major. And now you can see the pectoralis minor muscle. This is the pectoralis minor, and you can see the external intercostal muscles, and also this is the humerus, and you can see the serratus anterior also getting attached here, right? And in an unopened section, you can see like this pectoralis major, scaleniae muscles, and you can see the external oblique, rectus abdominis muscle, which is also coming to this thoracic region, that is in towards the thoracic cage. So these are all the other muscles which are helpful. So muscles which come from the abdomen to the thorax. So the first one is the rectus abdominis muscle. You can see the rectus abdominis again. See this one, whatever you are seeing here, this is the rectus abdominis muscle. So this rectus abdominis, it originates from the xiphoid process and costal cartilages, that is 5, 6 and 7. Coming to the external oblique muscle, it is attached to the external surface of the lowest 8 ribs, that is the lowest ones. And you can see serratus anterior muscle laterally, it inserting by finger like processes into the ribs, that is from 1 to 8 ribs, and also from the scapula. Now coming to the intercostal muscles, they are present in 3 layers: the external intercostal, the internal intercostal, the transversus thoracis, which is composed of the intercostalis intimae, sternocostalis, and subcostalis. So please remember, the intercostal muscles are present in 3 layers. First layer, that is outermost layer, is called as the external intercostal muscle. The inner layer is called as the internal intercostal muscle, and the innermost one is otherwise called as the innermost intercostal muscle, which is composed of the transversus thoracis. Transversus thoracis is nothing but it is composed of 3 muscular units called as the intercostalis intimae, sternocostalis, and subcostalis. Let us see in detail. The external intercostal muscle, its fibers are directed from superior and lateral to inferior and medial. It loses its fleshy tissue. See, this external intercostal muscle, as it goes down, it loses its fleshy tissue and becomes a transparent membrane anteriorly, which is nothing but called as the external intercostal membrane. Okay, please remember, this is called as the external intercostal membrane. So this is the external intercostal muscle. You can see how the fibers are running, downwards and also towards the thing. And now coming to the internal intercostal muscle. This internal intercostal muscle, its fibers runs perpendicular to those of the external intercostal muscles. The external intercostal muscle is going down, so it is just these internal intercostal muscles are like going perpendicularly up. So posteriorly on the thoracic wall, it becomes, see now as it is going towards like posterior side, posteriorly on the thoracic wall, this internal intercostal muscle, it becomes gradually thin and forms another membrane called as the internal intercostal membrane, that is from the angle of the ribs. So coming to the next one, that is the innermost intercostal muscle, the deepest and also the thinnest intercostal muscle. During dissection, it's very tough to separate these muscle layers. And all these 3 intercostal muscles, they are accessory muscles of the respiration. Okay. Now coming to the next part, that is the intercostal space. Please remember, this intercostal space is present between the interval or the internal, between the space which is present between the internal intercostal muscle and the transversus thoracis muscle, which is the innermost one. Okay, so you can see in this picture how it's very clearly shown, right? So if you enlarge this section, this is nothing but a transverse section of the thorax. In this transverse section, you can see how the ribs are like going out, right? And now you can see the aorta, okay, just adjacent to the vertebrae. This is the thoracic vertebrae, you can see, and now you can see the sympathetic trunk which is traveling here. Okay, so from here you can see the intercostal spaces where the nerves are coming, right? So typically this intercostal space contains a nerve and also artery and vein. So most important one, you can see this is the anterior ramus of the intercostal nerve, and this is the internal intercostal membrane, which you are seeing a small line. You can see the muscle getting thinned out, and now it is forming the internal intercostal membrane. Now this is the external intercostal muscle, whatever you are seeing, outermost one, and now you can see the lateral pectoral cutaneous branches, right? How they are dividing. So, and now once they come here, now you can see the external, as you are moving anteriorly, this is the sternum. As you are moving anteriorly, you can see this external intercostal muscle is thinning out and forming a membrane called as, you can see this membrane line, black line. This membrane is nothing but called as the external intercostal membrane. So now we are seeing 2 membranes. One is the internal intercostal membrane, which is seen over the posterior side of the thorax, that is towards the vertebrae, but anteriorly towards the sternum you can see the external intercostal membrane, which is formed by the external intercostal muscle. Okay, so now let me show you the neurovascular arrangement in an intercostal space. That is nothing but called as the van of costal group. Why it is called as van? Because according to the location, superior to inferiorly, up from above downwards, you can see, you will be seeing first one is nothing but the vein, that is intercostal vein, and then the intercostal artery and the intercostal nerve. That is the reason we call it as van of coastal groove. But in this part, what you have to remember is like, where are these arteries and nerves traveling from? Vessels. So in a typical intercostal space, what is happening is like, these vessels are present between, you can see the internal intercostal muscle and the external intercostal muscle. So you can see the external intercostal muscle is first reflected, then even we cannot see these structures, that is the vessels and nerves, then even we have to cut and open the internal intercostal muscle also. So once you reflect these two muscles, then you can see the neurovascular bundle which is present between, that is nothing but the internal intercostal muscle, and this is nothing but the innermost intercostal muscle called as the transversus thoracis. Okay, now you can also see the external intercostal muscle here again. Okay, and this is the internal intercostal muscle. So in this way, from above downwards, the neurovascular bundle lies like, it is in the form of a van, that is vein, artery and nerve. Now, most important thing, I was continuously telling like, what is this thoracis, transversus thoracis? Sometimes I am calling it as innermost intercostal muscle, and sometimes I am telling it as a transversus thoracis. See, this is nothing but a sternum. Sternum is there. So what is happening is like, try to imagine that now you have removed all the lungs and everything from the thoracic cage. Okay, then you are just looking from the inner aspect. So if it is the sternum, I am looking from the behind. This is the anterior part of the sternum. This is the anterior part of the thoracic wall. Okay, wherein you can see this sternum in between, but I am looking it from behind. So in this view, what happens is like, you can see the transversus thoracis muscle. So you can see now here it is very clear, there is a subclavian artery, brachiocephalic vein, and now you can see the internal thoracic vein and artery. Okay, now please see here, you can see the second and third intercostal nerves. From here, you can see one muscle called as the transversus thoracis, right? This is the transversus thoracis, okay? And now you can see the transversus abdominis muscle, and this is the diaphragm. Now you can see the posterior surface of the sternum, okay? And also now you can see two more muscles just here at the top of the neck region, that is along the at the region of the inlet of thorax. That is nothing but the sternothyroid muscle, sternohyoid muscle, and laterally you can also see the anterior scalene, that is the scalenus anterior muscle. Now coming to the arterial supply of the thoracic wall. This thoracic wall is supplied by various branches. The most important branches are the posterior intercostal artery and the anterior intercostal artery. You can see this one. So this is the anterior intercostal artery which is coming here, and this is the posterior intercostal artery. How they will form, I will show you. This is a very easy picture. Basically, the thoracic cage or the intercostal muscles, they are being supplied by one important artery called as the internal thoracic artery. So this internal thoracic artery gives two branches called as the various branches which goes to the intercostal spaces and which supplies the muscles and also that region, that is the pectoral region. And this internal thoracic artery is very important in case of the blood supply to the mammary gland. And at the same time, you can see other branches. Please remember, this is the thyrocervical trunk, which is a very important short question for you in the examinations. So there are various branches for it, but however I am not going to insist, but this is a very important one for the examination purpose. So but the first two intercostal spaces are supplied by the supreme intercostal arteries. You can see here how they are coming, right? And this is the costocervical trunk, which is again taking its origin and it is going towards the cervical region. Coming to the venous drainage. The venous drainage of the thoracic wall, the veins, all the venous blood is drained by three important veins. I don't want, because why I kept this picture is because azygous system of veins is a very important essay question for you in the examinations. It's a very important essay question. So that's the reason why I have kept this picture. Please see how the azygous veins are formed. You can see this is nothing but all the lumbar veins. All the lumbar veins join together to form the ascending lumbar vein. And now this ascending lumbar vein will be joined by again the subcostal vein Then finally it will form a large vein called as the azygous vein. However, this azygous vein also receives lot of tributaries from the intercostal spaces, okay, and see one side it is forming the azygous vein, right, that is like the on the left side, right, but on the other side what is happening is like the same subcostal vein is joining and it is forming another structure called as the hemiazygous vein. Okay, so along with this azygous vein and the hemiazygous vein, there is another one called as the accessory azygous vein. So this whatever region which is being drained in between the 5, 6, 7, 8 ribs, this all these veins will join together to form another vein here, which is nothing but called as the accessory hemiazygous vein. In this way, coming to the thoracic venous drainage of the thoracic wall, there are three important veins. Please remember, one is the azygous vein, the second one is the hemiazygous vein, and the third one is the accessory hemiazygous vein. Now coming to the thoracic inlet, the upper end of the thorax, which is continuous with the neck, that is anteriorly the upper part of the manubrium and the sternum is present. Posteriorly, the superior surface of the body of thoracic, that is the first thoracic vertebrae, will form the boundary. On lateral sides, this thoracic inlet is like bounded by ribs along with their costal cartilages. You can see this is the inlet of the thorax. Now there is some important membrane called as the suprapleural membrane or the Simpson's fascia. So it is a dense facial layer, because this is a very important 3 marks question for you in the examination. What is this suprapleural membrane? I'll just show you a picture. You can see this one, right? This is nothing but the suprapleural membrane. So what is its importance is because it is a dense facial layer. It is tent-shaped fibrous sheath attached laterally to the medial border of the first rib and the costal cartilage. At its apex to the tip of the transverse process of the 7th cervical vertebrae. Medially it goes to the fascia, investing the structures passing from the thorax into the neck, and it mainly protects the underlying cervical pleura and also resists the changes in intrathoracic pressure occurring during the respiratory movements, that is breathing in and breathing out. So this is the importance of this Simpson's fascia. Now let us see what are the structures passing through this inlet. So structures passing through the inlet of thorax, that is the important arteries. What are the arteries which are passing? That is nothing but the large arteries are the brachiocephalic trunk. So you can see the brachiocephalic trunk here, right? And now the left common carotid artery, okay, and also the left subclavian vein, okay, left subclavian artery and the left common carotid artery. So these are the 3 important structures which will pass through the inlet of the thorax. And what are the veins which pass through the inlet of thorax? That is right and left brachiocephalic veins. See, this is the right brachiocephalic vein and this is the left brachiocephalic vein. So these structures also pass through the inlet of thorax. Coming to the viscera, which are passing through the inlet of thorax, you can clearly see that is nothing but the trachea, okay, esophagus. You can see the apices of the lungs and pleura, okay, and also of course you can see small orange color structure here. This is nothing but the remnants of the remains or remnants of the thymus gland, okay. So in this way, these are all the visceral structures which are passing through the inlet of the thorax. So again I am repeating, they are nothing but the trachea, esophagus, apices of the lungs and pleura, and also the remnants or remains of the thymus gland. Coming to the thoracic inlet, the contents. Just now I told you the arteries separately, veins. Arteries are 3 arteries, that is the brachiocephalic trunk, left common carotid artery, and the left subclavian artery. Coming to the veins, that is nothing but the right and left brachiocephalic veins. And other structures I told you already, that is nothing but the trachea, esophagus, and also you can see this is one apex of the lung with the pleura. So these are all the structures which are passing out through this inlet of thorax. And see how the inlet of thorax is bounded on lateral sides by the first rib along with its first costal cartilage, right? And also anteriorly by the body of by the manubrium sterni, and posteriorly by the first thoracic vertebrae. These are all the details of the inlet of thorax. And also nerves which passes through the inlet of thorax, that is phrenic nerve, the vagus, sympathetic trunk, and the first intercostal nerve and the left recurrent laryngeal nerve. These are all the nerves. Again, I am repeating: the phrenic nerves, vagus nerve, sympathetic trunk, first intercostal nerve, and also the left recurrent laryngeal nerves. Now coming to the muscles which will pass through the inlet of thorax. That is nothing but you can see clearly here anterior side. What are the muscles? Just now I have explained you, right? They are nothing but the sternohyoid, sternothyroid, and the longus colli muscles. Now coming to the lesions, that is thoracic inlet and outlet lesions. You can see the scalene is posterior here, the scalene is anterior here, okay, and in between these two you can see the neurovascular bundle, that is the brachial plexus, which is coming out. So sometimes there will be an additional rib called as the cervical rib. So whenever there is this cervical rib is present in few individuals, it is like not commonly seen, but some people will have this cervical rib, which is small one. What happens is, like, this cervical rib, once it is present in a person while performing any activities, this can like compress the neurovascular bundle here, okay, you finally leading to a condition called as the cervical rib syndrome, okay. Coming to the thoracic outlet. So the thoracic outlet, you can see once the ribs are cut in the anterior part, now the anterior part of the sternum is removed, the thorax is removed, okay. So once it is cut in the in between on both sides, now you can see the outlet of thorax, which is clearly like bounded by a muscular structure called as the diaphragm. So the diaphragm is an important structure which will like cover the outlet of the thorax. You can see it very clearly, okay. This is the diaphragm, and of course this you can see now where the two like right crus and the left crus of the diaphragm are getting attached, and you can see the U-shaped curve shape, and this is nothing but the 12th thoracic vertebrae. Here you can see this level, at this level you can see the 12th thoracic vertebrae, and this is the structure of the diaphragm. And of course the diaphragm is even being pierced by other structures, and it is a separate topic wherein we will be explaining you again. So with this, the thoracic cage, that is, and also the intercostal muscles and their nerve supply, and most importantly this inlet of thorax has been completed. So I hope you understood this topic. Definitely we will again meet back with the next topic tomorrow, right? Thank you.